Thank you so much for clicking in. I'm Nicole Mischke, and naturopath Dr. Al Morgan is joining me today. He's been treating natural medicine and patients here in Spokane for over 30 years. Before I begin, though, I want to let you know that this is the first of a series of talks that we're going to be doing. And we're going to be talking about natural medicine and why an integrative approach to healthcare may be something that you want to look into. But I want to get you involved in our discussion. At any time, any day you're watching this interview, if you have a comment or question, please tweet us at @FindTheCause along with the hashtag DRAL. Dr. Al. This will allow us to personally respond to each of you, and we may even be able to include you in our next segment. Okay, so we live in what I like to call the instant society. We all want our problems, especially when it comes to healthcare, solved instantly and with the least amount of effort possible. We seem to have adopted this idea that we can take a pill to solve anything. If you want to lose weight, just a couple different pills for that. If you can't sleep at night, just a couple different pills for that. What about if you have chronic fatigue? Pills for that. Weight loss, pills for that. I mean, the list goes on and on. Pain medicine. We have become so reliant on pills to solve our problems. Now, I'm not saying that all prescription drugs are bad. I'm not saying that. I'm simply trying to draw attention to the way we have been taught to fix our health problems. We've become so used to treating our symptoms, but what we need to start asking is what is causing our symptoms. This is the question that Dr. Al Morgan has been asking and answering for thousands of patients that he's treated as a naturopath in Spokane for the last 32 years. Dr. Al, you believe that an integrative approach to treating people and their healthcare problems is the best way and that it's actually the future. We're doing these series of talks really because you want to raise awareness. Talk about the need for the awareness on this.
For so long, there's been two distinct, separate systems of medicine, and they've been polarized for a long time. They're just beginning to merge, blend, work together better and better. And this, I think, is a better approach. It gives patients more options, and it's easier for me to give them a range of options based on safety and effectiveness. So they have choice. Now, these two models are typically known as balancing medicine, naturopathic medicine, some call it. This is having more to do with prevention and treating chronic conditions. The other type of medicine we call allopathic or traditional medicine, and we call that more of a crisis-oriented medicine for more severe, life-threatening things, structural repair. They're both really, really important. They have strengths each. They both have weaknesses. When you apply them, in what situation is really the key. How you blend them is the key as well. And that's becoming a new emerging specialty. And it seems to me that as the years go by, that's more and more what people are wanting.
Well, and you actually work with a lot of doctors in the area. We're going to talk about that in a second. A lot of your patients are referrals from other doctors. But you say that you're hopeful for a healthier future. Now, I hear you say that, and I look around and I look at our country, and we have the highest rate of cancer, heart disease, stroke, heart attack. I mean, the list goes on and on. We're not exactly the model country that people want to be looking to for living a healthy lifestyle. What gives you hope that there is going to be a healthier future for us?
There's more and more information out there, so much so that people get overwhelmed with it when they try to do their own self-diagnosis, self-treatment guesswork.
I've done that, not gonna lie.
It ends up frustrating a lot of people, and they lack hope, and their confidence is breached. So if you have somebody that can explain how these things work, which tests will find underlying factors that you can measure, identify, respond to, then maybe you don't have to wait until a condition gets worse and worse and worse.
Well, and we're going to talk about the testing in a second, because you actually do have very unique testing so that you are uniquely treating a person specifically for their needs. There's no one recipe for everybody that has a migraine. Every person is different. But you're talking about people struggling with trying to find out, you know, why do I have chronic pain, or why can't I sleep at night? And they get so sick and tired of trying one thing and then another thing and then another thing, and then it just doesn't work. So talk about your philosophy of treating the cause and finding it versus just treating the symptom, and why that way of treating people is so critical to living a healthy lifestyle.
I think first, people are becoming aware of this idea. They're waking up to, is there an underlying cause? Can we find it? Does it apply to me? How do you
Could you
test
say there's
it?
always an underlying cause?
Well, we don't know all of the underlying causes to all diseases, but there are a lot of them that we do know that the mainstream public doesn't know and our traditional system does not address. It's not really considered a life-threatening crisis all of a sudden. So I think people are becoming hopeful and more motivated, more enthusiastic, because they know they don't necessarily have to just keep masking their symptoms and wait for something worse to happen down the road.
Well, I want to go back to your philosophy of doing no harm to the body. Talk about that, and also the fact that the same symptom for people can have a bunch of different causes. And if you don't know the cause, you could actually be doing a lot of damage.
A lot of people come in with a common symptom and they've read maybe online or a popular book, oh, if you have this symptom, you have this problem, so you buy these products. And when that fails, they become even more discouraged and they say, I've tried everything. So I really think that masking the symptom is not what people are looking for as much now as they did maybe 30 years ago. My practice is flooded with people who are sort of ready to try something else. What have I missed? Is there anything else that I can do? Because I want to be involved in my own health care and drive the boat.
Talk about the example previously when we've talked about a woman that comes to you and she has really bad PMS symptoms and irregular periods.
This is one of the most common conditions that comes to me in frustrated women, all ages. And oftentimes they have tried various levels of hormones, patches, typically birth control pills. And we know that this condition, PMS, irregular periods, is usually due to a hormone imbalance where estrogen is enough, but progesterone is not enough. And the body feels better when it's balanced. And it's a estrogen dominant situation that we call it. Now, that usually is what's causing the big intense problems. So if you give a birth control pill, it can minimize, reduce the intensity of those symptoms, but you still have an estrogen dominance situation because the pills are estrogen dominant. The danger of that long term is that since estrogen is the one that feeds growth of breast tissue so much, unless it's opposed by counterbalancing effect of progesterone, you're at higher risk later for breast cancer because the effect of estrogen over time is cumulative. It's not forgotten what happened 20 years ago.
And that's one of the differences I know of what you do is those hormone testing. It's a very simple test that you do to look at someone's hormones and figure out if they are imbalanced. And we're going to get to that more. There's a lot we could talk about, but we're going to try to keep this as short as possible and then talk about more in the future. But I want to talk about your history a little bit, get a little personal. You went to pre-med school. You were actually from a medical family. You always thought that you would become a doctor. At some point, you transitioned and decided after pre-med school, I'm going to become a naturopath. And it was personal experiences in your life, I know with your own health care, and actually watching your mother struggle with an alcohol addiction that she was self-medicating or using as a self-medication for depression. Talk about those experiences that made you have this aha moment, like this is what I need to do.
Well, I had so many childhood illnesses, a son of an eye, ear, nose, and throat specialist. I had recurring ear infections, bronchitis, even pneumonia, ultimately developed asthma, had a lot of infection, failure to thrive, partly because of a severe lactose intolerance. Now, these things were never asked about, diagnosed as to what the underlying cause of these recurring and persistent weakening symptoms were. So I became increasingly disillusioned and lost confidence over the years. So I was in the end stages of my pre-med studies when I just realized, you know, I'm really interested more in these mysteries of how do you get to the root of things and not just keep treating symptoms, because I'm doing that. And for 20 years, I'm just getting worse and worse and worse. So
that's kind of what sparked it all. What about with your mom? And and the self-medicating that you saw happening because she was receiving inadequate treatment for depression.
It brings up the idea of self-medicating, and a lot of people are self-medicating because they want to feel better, but they're not sure what's wrong. So they just want to distract themselves from their suffering. And you can self-medicate with anything. She chose alcohol. It ultimately killed her, along with the cigarettes. But she had a sleeping disorder and a variety of things that could have been treated better. And there are other things that could have been done for her overall health. And I just had to sit back and watch this thinking, something's missing here.
Well, when we talk about the same symptom can have a lot of different causes, do you think that that is the main reason? Does that get at the heart at what is wrong with traditional medicine? That they're not looking to find what's uniquely wrong with a person?
Well, I think in a lot of situations, especially the kinds of things that come to the hospital, the emergency room, to acute care clinics, they really do look for the underlying infection and stuff like that. But there's so many chronic things that are just driving people crazy over the years, the great nuisances, limiting their freedom to have a full life. And they're just palliating the symptoms. They're not really getting over it. And a lot of things you can get over with. So the symptom can have a lot of different causes. So there are a lot of different tests, hundreds of tests.
Talk about one of the simple tests you do with this little tube right here. I don't know how well we can see this, but it's a saliva test.
Saliva, we'll get into this more when we talk about the best tests for the most common conditions. Now, saliva has great usefulness where blood doesn't in some cases. Blood is better in other cases. That's another thing. You have to know when to apply a blood test versus a urine test versus a saliva test.
I have to say, I've never had a saliva test.
The saliva tests are relatively new, though I've been using them almost 30 years. But I realize they haven't found their way into mainstream traditional medicine locally here yet. You can measure certain hormones with saliva more accurately than you can with blood. And sometimes you can just do other hormones with blood and get a fine response. But it's so non-invasive, it's inexpensive. You can get multiple collections easily. For example, throughout the menstrual cycle, a month-long time period of getting multiple samples to see how the hormones move over time. And they don't have to come in every 2 days for a blood draw. They can just take their tubes home and spit of them.
So after this test, and maybe some others, you can have confidence, I dropped it, you can have confidence that you're treating a person more specifically than if you were just saying, let's try this, like so many of us have experience. Oh, thank you, you have another one. There we go. Okay. Along with this unique approach to testing, I want to talk about the thoroughness that you take with every patient, because you told me you get this a lot. People will come in for their first appointment and they say, oh my gosh, no one's ever asked me all those questions. Why is that so important?
For me, everybody has a story. It's a unique story. They are unique. I'm trying to find out what's been missed previously, so I review all of their records and labs and ask them, what have you been through? What's worked and what hasn't worked? And where'd you grow up and what kind of environment was it? What kind of lifestyle did you have? What were the traumas and major stresses in your life? Which treatments failed? All of that stuff takes time. So I schedule an hour and a half to an hour and 15 minutes for new patients just to get this story, review all of this stuff, and begin to offer a list of options with my recommendations of, I think we should do these tests first and go from there.
Okay. You've been called a bridge and a pioneer. Talk about what those words mean to you.
For me, a pioneer is, it's been sort of my personality, my nature. I like to look forward. I like new things. I like to study futurists. I like new medicines, new science, new tests. I like to go to the labs and figure out how they work, how accurate are they, and I just wanted to be at the forefront of something that seemed like it wasn't happening in mainstream medicine my whole life.
Well, and you've done that. You teach other doctors, you travel around giving conferences and speaking to people to try to, you know, like the saliva test, which maybe hasn't reached mainstream yet, but your hope is that soon it will.
Yes. Now, bridging applies to not just bridging what I know to the patient, which they really appreciate, and back and forth, but also bridging to the referring physicians and to their primary care physicians, even if they don't know what I do. I like to write out an explanation in a letter format. This is how I'm thinking, here's what I think's going on, this is the theory, this is how we're going to test it, and this is how the medicines work. And then they get to see, okay, you're not stepping on what I'm doing, you're not displacing what I'm doing, it's actually complementing what I'm doing.
Right.
The patient's getting better, and I'm starting to trust you. And then we have an open line of communication going.
Yeah.
And then the whole system builds.
And that trust is so important. And when you can let the patient know and understand what's happening, knowledge is power, and it empowers them. And I think you kind of, as patients, we're like, oh, I get this, I get why I'm doing this. But you know, we have so much we could talk about. You've been doing this for over 30 years. Next time, we're going to be talking about the most common conditions you treat, and I just want to name a few here. Female hormone imbalances, which we kind of touched on, chronic pain, intestinal discomfort, slow metabolism, stress, difficulty concentrating, and migraine headaches. Those just name a few. People, I mean, what is it like to have people come to you who have been to other doctors and nothing seems to work, and you get to take away their problem?
Well, first, it's a sharing in their delight and their joy, and empathizing with where they're coming from. And I can empathize, having cried about my own suffering for many years and wonder, why am I so limited? So I know what that freedom feels like, and that, aha, this was what I've been looking for a long time. It also makes me feel honored to have the opportunity to work with people who are willing to be vulnerable and be responsible and get better. I'm also grateful that this path unfolded to me at a time when I could have easily taken the wrong tact and been an unhappy person.
That goes back to doing what you love.
Yeah.
Love what you do. Well, Dr. Al, thank you so much for coming on. And again, whenever you watch this, if you want to join in the discussion, or maybe if you want to be included in our next topic, tweet us at @FindTheCause, #Dr. Al. There is his website, phone number, and there's much more to come. So stay tuned, folks.